I see we have almost 20 participants. I'm Pat Sullivan, along with Bob Romer, the co-founders of the Heart Brothers. Thank you to our webinar series, our first one of 2022. And we want to thank all our corporate sponsors who have made this possible. And welcome all of you, and thank you to our speakers, and especially to our expert, Dr. Amanda Vest from Tufts Medical Center. And with that, I will turn it over to Hamid Badavi, our Director of Support Group, Webinars, and Other. Take it away, Hamid.
Good evening, everyone. My name is Hamid Badavi. I'm a heart transplant survivor. I was transplanted 5 years ago. Thank you all for joining us. It's a pleasure and a privilege to have you all here, and our great panelists, and Dr. Vest. I want to give you a brief, quick introduction to Heart Brothers, who we are.
Here's the contact info for Don Brothers.
What we do. We are basically patients like you. We have received a heart transplant, and we made the choice that we will be giving back to the community. Heart Brothers' goal is to help patients and their loved ones navigate a life of heart failure and all its complications. Pat did a quick thank you of our sponsors, but I'd like to do a little bit more detail. Their assistance and their grants make it possible for us to offer the various programs that we do. I want to thank the Transmedics, CareDx, Cytokinetics, Abbott, and Novartis for supporting us. Some of them have been supporting us since our inception 6-7 years ago. Well, I want to also say a little bit about the medical advice and suggestions you hear. This is based on our experience and stuff and Dr. Vest's medical knowledge, but we request that before you make any decisions, you please contact your physician and your medical center. Everybody's different, so you get the proper advice for your specific situation. And last but not least, just a quick reminder that we have started a new program called a patient support group. It's open to everyone. It is the second Thursday of every month at 6 p.m. And our next one is going to be on the 10th of February, and it is going to discuss about heart failure and heart transplantation in the minority communities. With that, I'm going to turn it over to Christian Jeeves. He's going to moderate our program tonight. I'll let him do more justice in introducing him, but thank you, Christian, and it's all yours.
My pleasure, Hamid. Thank you, everybody. We're glad to have you here. I'm not sure if I'm allowed to say this still, but I will say Happy New Year. I hope you're all having a great 2022. I am a husband to an amazing heart transplant recipient who happens to be on the screen. And I've been fortunate enough to be a part of the great work Heart Brothers does ever since that event. So I'm really looking forward to the opportunity today to help facilitate this discussion and hear from some extremely inspiring mothers, as well as Dr. Vest, who has a lot of knowledge in this area. What I'll do is I'll do a quick introduction of the 4 panelists, and then I'll turn it over to them to do a longer intro and tell their story. First, we have Shayla Jeeves, who is both my amazing wife and mother to my 4-year-old twins. She was diagnosed with heart failure in her 20s and then received a transplant prior to having children, and then proceeded to have a surrogate carry for us as a mother later on. We have next Tiffany Dunn, who is a 34-year-old, currently resides in Southern Maine with her husband and 3-year-old daughter. After experiencing heart failure, Tiffany had an LVAD implanted and had a heart transplant March of last year at Tufts Medical Center. She's also a student working towards her master's in social work with plans to support others as she was supported throughout her own process. And then we also have Karen Klismak, who was diagnosed with hypertrophic cardiomyopathy in her early 20s. And after 6 years of careful deliberation, she decided she was going to carry to full term. And in the following 3 years, as she saw a decline in her own health, did have a heart transplant at Tufts on New Year's Eve 2020 / New Year's Day 2021, which is a very exciting way to start a new year. She currently has a 5-year-old daughter and extremely supportive husband and family, and she's excited to be able to celebrate her 1 full year with a healthy heart. And then finally, last but certainly not least, we have Dr. Vest, who is the medical director of heart transplantation at Tufts Medical Center, who will be sharing some facts and figures that I'm sure a lot of people will be curious about as we have this conversation. So without further ado, I will turn it over to Shayla first to tell a little bit more about her story, and we'll go from there. Shayla, the floor is yours.
Thanks, Christian. First, I just want to say, if you hear any background noise, it's my dog right at my feet. He's chewing a bone, so just let me know if there's any other noise there. But anyway, my story began when I was 21 years old. I was in college and started to really struggle with just doing day-to-day activities. And it was, heart disease can sometimes be pretty quiet, and I didn't really understand how to communicate what was going on. So they initially thought that my struggles were due to asthma. So I was on an inhaler for about 6 to 9 months after I realized that wasn't helping. Went back in and I was diagnosed with dilated cardiomyopathy. And for about 10 years, from 21 to roughly 31, I managed pretty well. I was in Boston at the time in school, and then I had lived in Washington, D.C. for 5 years, and then actually met my husband, Christian, and was in New York City with him. So we, tried to live a pretty normal life. I'd say it was harder for me because I was trying to keep up. And when you're in your, 20s, you're really trying to learn all you can, go to school, start your, new job, and meet new people. So I think just with it being such an active lifestyle, and obviously being in a city, I definitely had days that were harder than others. We actually moved back to the Boston area, and at that point I noticed things started to get even more difficult for me. And when I was first diagnosed, my ejection fraction was around 25%. When we moved back to Boston, I realized things were starting to go downhill. And at that point, my ejection fraction was then at about 5 to 10%. So it has ran its course. I mean, I think 10 years is pretty good stint for keeping my disease at bay. So at that point, I was listed for a transplant, and Christian and I had already been married for about a year or two, and we had discussed kids, prior to even getting married, and he knew that, the chances of me getting pregnant or really, having the desire to carry a child weren't there, knowing what some of the risks were. So we were trying to plan for a family. I did speak with my cardiologist, and I think it was, a few different factors went into it. One was the medication that I would be taking post-transplant would be detrimental to the fetus. I think, and I'm sure Dr. Vest can clarify this, but there are medication and ways to manage that. It did seem somewhat complicated. And then the other piece that really spoke to me was that, even if I were to carry, that the having birth itself could potentially harm my new heart. And that scared me because I had already been through a lot. And I thought, well, if I go through this heart transplant and then end up in the same position, then that's just a lot to handle, not only for me, but then I thought about my new husband and then my family. So Christian and I knew that when the time came, we were probably going to adopt or seek, alternative methods than for me carrying. So at that stage, we actually were looking into adoption. And this was when I was listed for transplant. And in hindsight, that was probably not the best plan of action for us to take. But we knew that the process took a very long time. So we thought, why don't we get our ducks in a row? And then when the time is right, hopefully we can take action there. So in March of 2015, things started to decline even farther. And then in May of 2015, I was admitted into the hospital, and I was put on a swan. So I was essentially in the hospital, mostly in bed, with 2 different types of medications. And they were trying to just keep things at bay and potentially have me on an LVAD, but the hope was to get me straight to transplant. So thankfully, I was transplanted in July of 2015. Everything went, smoothly, and we were able to, be home that summer, which was really great. Soon after that, we had realized we had gotten pretty far actually with the adoption process. We were looking at profiles when I was in the hospital. And if I'm being honest, it was a pretty tough process for us, I think, because they were really just trying to look out for the benefit of the adopted child and make sure it was going to be a stable, predictable home. And I think that they really honed in on a lot of detail in terms of my health. And I think at that time I was feeling really vulnerable, and it was just, the timing was bad for us, but I think it was hard for us to realize that things could, go a certain way in the future, and then that the child would essentially be, having to deal with my health as another issue for them. So with that, we decided after transplant, it was kind of like setting a new life really for us. And we thought, well, why don't we try surrogacy? Because, there wasn't any other reason besides physically carrying a child that we couldn't have one. So I went through the Ivf process after transplant. We started looking into surrogacy pretty soon after transplant. I would say it was even months, honestly, because it just took so long. It was, it takes about a year even to get matched. I wrote here, what did I say? We were matched the summer of 2016. I had to look back. And so that took a while. And when I was going through the process of the egg retrieval, and again, this is a very unusual thing that happened, but a few days after retrieval, I had some pretty severe back pain. I called the hospital, and they thought maybe it was just like some retrievals would cause back pain. So I waited. Months had gone by, and the pain had progressed, and I actually went to see my cardiologist, who noticed that I was in some pretty severe discomfort. I mean, Christian obviously was there. I couldn't really even pick anything up. It was very difficult for me to bend down. So he was kind of like picking up anything I had dropped on the floor, and it was really getting to a point where there was some serious concern. So thankfully, my cardiologist put the pieces in place where I got some tests done, and turns out that I actually had a group strep B and staph infection in my backbone. So what happened is when the needle went in to retrieve the eggs, it essentially skinned the back of my backbone and infected it. So very, very rare, but I was able to get the treatment I needed. It was 6 months with a IV for an antibiotic, but it completely healed me, and I was totally fine. And then the timeline of that is we had our surrogate, and she was actually pregnant alongside all of this. But the good news is that I was, healthy and fully cleared once we were able to have our twins. So we had girl-boy twins that were born in October of 2017. So that was really exciting. That's a whole story in itself. But they were born in Houston, Texas. We flew down, and we were there for a week before, waiting for the twins to be born, and then flew them back up as new parents all by ourselves. So that was pretty daunting, having been parents for 24 hours, or really 36 in the end, and taking them on a plane back home. So Drake and Annalise are their names. They're now 4 years old. They are wonderful. We have them at my sister's right now. They're a ton of work. I think one of the things that everyone was concerned about is that, motherhood is an undertaking, but then twins is really a whole other story. especially with a mom who's had a heart transplant. So there was certainly a lot of concern around me being able to manage the twins. But, I have a great husband. I think he knew what he was getting himself into, and he's really a hands-on dad. I have a great support system. The twins are actually my sisters right now. So having a family and, community around me to help, I think really helps us. And as far as my health since transplant, the IVF bit was, of course, unexpected and scary, but that was really unrelated to my heart. And I've been feeling great. So I certainly have days where I'm exhausted, but I'd say it's just like typical mom tired, needing to go to bed, and the next day I feel just fine. So so grateful and happy to answer any questions. We do have some info on adoption, and certainly lots of info on surrogacy and IVF for anyone that has, any more detailed questions. I'm happy to answer those.
Thank you, Shayla. I obviously know your story very, very well, but it's very inspiring nonetheless. I hope you all found that very interesting, and thank you, Pat. came off the camera just to show it. So I did, with that in mind, actually, Shayla, it's a good reminder. I did forget to mention Q&A as well. We want this to be a very interactive session. So for those of you attending, if you did have questions, there should be a Q&A button. If you're on an iPad, it's on your top right corner. If you're on a computer, it's generally on the bottom. And feel free to type in questions, and we will address them and ask them wherever they may be appropriate. So just one reminder on all that. So with that, I will turn it over to Tiffany to help her share her story.
Thank you. Yeah, it was great hearing Shayla's story. One thing that resonated with me is how she mentioned that heart failure can be kind of quiet in the beginning. So it's similar to my story. Basically, everything started when I was pregnant with my daughter. This was in 2019, and excuse me. So basically, I was going along, a normal pregnancy. I had no sort of heart issues before that, no major health concerns or anything like that. It was my first pregnancy. So I started to notice that I had a lot of swelling in my feet and really bad shortness of breath. And at first, seeing my doctor, those are kind of normal symptoms for pregnancy. So it was kind of chalked up to just, normal pregnancy symptoms, but then it started getting kind of worse and worse. And eventually, when I was 34 weeks pregnant, it got so bad that I couldn't, walk from my room to the kitchen, for example, without, pausing to lean on the counter and take a breath. It was really hard for me to do any sort of activities of daily living. It's hard for me to get to work and things like that. So one day I stopped into actually a Walgreens because I wasn't feeling well. And the pharmacist there said, took my blood pressure, and he said it was really high. And he actually recommended that I call my doctor because I was pregnant at the time. And I said, okay, So I called the doctor, and they said, yeah, why don't you just go into the hospital? We'll just have them check you out and everything. So I'm like, okay. So I go to the hospital, and I was there in the room. They did a bunch of tests. I remember I wasn't able to really lay flat on the bed. I had to be propped up because when they laid me flat, I basically couldn't breathe. So they did a bunch of tests and everything. And then I called my husband. He came there. So he was there kind of waiting with me. And eventually one of the doctors just came in, and she just flat out said, we looked at your tests. They did an echocardiogram, and she said, you're in heart failure. And I was just shocked. I didn't really know what that meant. And, all sorts of thoughts are going through my head and everything. And she basically said, you're in heart failure, and we need to get this baby out as soon as possible. So 34 weeks, they scheduled a C-section for the very next morning. And we weren't totally prepared at home, with everything, ready for a baby or anything like that. Yeah, so they did a C-section. It was really scary because, since my daughter was 34 weeks, they said, she could have any number of issues, when she's born. You might not be able to hold her right away or see her. We may have to whisk her away to give her oxygen and stuff like that. So it was kind of scary not knowing really what to expect. But thankfully, when she came out, she was okay. They did, bring her to the NICU, and she was there for 2 weeks. So it was a lot to take all at once, I would say. Having a daughter in the NICU, and I had no experience with really hospitals or anything like that at the time. So it was all really new to me and kind of confusing. And afterwards, we went home with her and had her at home. I was still obviously experiencing heart failure symptoms, but the doctors basically said, that we'll give you these medications and hopefully your heart will recover. I was diagnosed with peripartum cardiomyopathy, and they said that sometimes the heart will recover after, giving birth. And so that was the hope, that with these medications and kind of following a regimen, that it would improve. But unfortunately, in my case, that didn't happen. My ejection fraction continued to decline. I started at like 36%, and it kept on, going lower. I eventually had a stroke in March of 2019. I had my daughter in 2018 in July, and then I was on medications. And then in March of 2019, I ended up having a stroke. And so the doctors were really concerned about my heart and heart function. And so they basically said, the best option would be for me to get an LVAD and, a heart pump, basically, that helps your heart circulate blood. And I got the LVAD in May of that year of 2019. So it was challenging because I still had, a young child at home. And I was having to deal with this new equipment, this medical equipment, lots of doctor's appointments and things like that. Throughout this whole time, I was in school as well, to earn my degree in social work. And so it was a lot, but I was able to manage. I had a lot of family support as well. And, my husband and everything were great. So I'm really thankful for that. So I got the LVAD in May of that year, 2019. And then I basically had the LVAD for 2 years. I had to do some things to get on the transplant list, like dental appointments and things like that. Finally, when I got on the transplant list, I waited 6 months and then eventually had my transplant in March of last year. And yeah, so I've been doing pretty well since then. Ups and downs, as I've learned, is common for this process. But yeah, I'm really thankful that I was able to get the transplant and continue on with my education. It's allowed me to continue going to school and being like an active member of my family, which was really important to me. So that's the basics of my story.
Thanks for sharing, Tiffany. That's a very amazing story. It's just a really amazing story and very inspiring. So thank you so much for sharing all those details. All right, so Karen, I will turn it over to you to help you share your story as well.
Hi, thank you so much, Christian. And thank you, Tiffany. I'm just like amazed at your bravery and how much was thrown at you in such a short period of time. Like you mentioned, not being used to hospitals and anything heart related. And then to not only have all that tossed at you, but then also to have a newborn and to maintain your education and to just get right into life. I mean, in my case, and I know with a lot of us, we've had years of this, but then to be tossed all that in a matter of short period of time, I'm baffled. And here you are already helping others and inspiring all of us. So thank you so much for sharing. I was really curious to hear a little bit more about that. So thank you so much. For my story, I'll focus on the pregnancy stuff because I think, just to kind of round out the panelists here. But as Christian mentioned, I was diagnosed in my early 20s with hypertrophic cardiomyopathy. And I'd been getting treatment since my early 20s and also ventricular arrhythmia. So that kind of threw a wrench in things too, in terms of symptoms that I was experiencing. But in my 30s, so about 10 years or so after being diagnosed, give or take, I really started having a desire to want to have a child and to kind of look into what that would look like. So I worked with my doctors who were Dr. Marin at the time, Dr. Barry Marin out of Minneapolis. And when I went to him, I just described what I was feeling, not only the want to have to have a baby or start a family with my husband, but also, kind of where things were at in terms of my heart condition. And he looked at me, and he's always been very honest. He was the one who first diagnosed me. And he said, "Karen, you're actually in heart failure right now. So I don't think the reality of having a baby is really something that we need to be talking about, unfortunately." So as you can imagine, I was pretty crushed, just having this thought in my mind and really trying to work it all out. So it took some time. And I knew that if this was something that I really wanted, it was going to take a lot of planning and a lot of deliberation to figure out if this could be a reality and how I could make this happen with the state of things. So at the time, I can relate actually quite a bit to Shayla's story in that my husband and I were living in Chicago, pretty busy lifestyle. We were living actually in the suburbs, but commuting in and out. And, again, being late 20s, early 30s, you're very active, you're busy, starting and really getting into my career. And I realized that in order to keep up with my heart condition at the time, a lot of that had to take a back seat, and I really wanted to focus on what it was that the next step would be for me. So with the advice of my doctor, in my mind at this point too, just having the mindset of a younger person, I thought, oh no, I can be superwoman. I can handle all this. But my body was saying something else because I was becoming short of breath. I started some new medications to help with some fluid. I was just slowing down quite a bit in what I was able to do in terms of work and activity and, gosh, even thinking, to be honest with you. And that was becoming apparent in just the way I would feel. As much as I wanted to blend in with everyone else and tell everyone that I was okay, the reality was that I was slowing down. And I really had to take in what Dr. Marin had said, that I was in heart failure, which was, that's a lot for anyone to handle. So, I decided, I've got to really take some action in addition to the medications and slowing things down. I started meeting with Dr. Marin out in Boston, Dr. Marty Marin, because my family's in Connecticut. And I met with him one Thanksgiving. And, he said, well, the way things are looking, we might want to consider transplant at some time, which is like the big D word. I was definitely very afraid of that, and stayed a few extra days to start in with some testing and figure out. And we determined at that point that wasn't quite the path. But living in Chicago, I was just a bit too far away with the healthcare team that I felt the most comfortable with. So we did decide that within 2 months, we sold our place in Chicago, and we moved back closer to family into Connecticut, and really wanted to focus on my health. And when I was here, that those thoughts of having a child really came up again. And what I had to do is I continued to work remote for my company, but like everything was remote. So that was a lot easier for me to handle in terms of energy. So that lasted another year. And in that time, I really took on more mind-body care and a lot of self-care for my condition. My husband and I, we had a little dog, we had family close by. So I was able to do that and really figure out what I wanted, which again was starting a family and really balancing work and life. And so around that time, I also took more of an easier position, I would say easier, but less work position, where I was just working with clients and things online. And, I really decided that this was something I wanted. So at this point, things were looking better with my heart. I was in more of a stable heart failure situation, whatever that is. But for me, what that looked like was, my medications were stable, my numbers were stable. While I did get worked up for some of the testing for transplant, I wasn't quite at that cutoff mark. I wasn't quite there yet. And actually things were improving. My appetite was improving. I was able to just manage things a lot a lot better with this care team, being closer to family and not taking on a lot of extra. So around that time, so this is about 6 or so years after, about when I was about 36, I worked with Dr. Marin and the Hypertrophic Cardiomyopathy Center at Tufts, and we developed a plan for me to become pregnant. And what that looked like was meeting with my cardiac team every trimester. And be it that I lived in Connecticut, I went to my local hospital, which happened to be UConn, and they did a lot of extra checking over of me as well. So I was in there pretty much weekly. So it was a big commitment on my end, but it was something I just couldn't wait to commit to. Everything really, really went well. And to be honest, during pregnancy, with the extra fluid volume and I think the extra hormones, I felt great. I was more active than I was able to be actually for years prior to that. It was like a renewed sense of what I remember from before my 20s, when I was a super active person, for the most part, within reason. But I did feel really well, and we developed a plan where I was able to deliver the baby. We were going to deliver her a little bit early, so she came at 37 weeks, which was a safe place. The baby looked good. She was a little bit underweight, which is to be expected, but we looked at all the medications I was on, and we did have to change a few. So backing up a little bit, we did have to modify some of the medications that I was on, just to make sure that they were as safe as possible for the baby. So there was a lot of back and forth. One medication that I was on in particular was actually to increase my blood pressure. And that was something I really had to minimize during pregnancy, but with the extra volume with fluids and just looking at what my goals were, we were able to definitely make that happen. So if any takeaways from this experience and during pregnancy while in heart failure, I would say one of the main things is really keeping in communication with your doctors, no matter how small the symptom is or what you're thinking, and just being really proactive with what you're noticing and what you're feeling. That was really important for me. And getting the extra checks, I was fully committed to this. So being at that, I worked mostly online. That enabled me to have more flexibility, but that was a huge commitment as well as taking on less work. And to be honest with you, with where my health was before pregnancy, that was what suited me best, in terms of my symptoms, in terms of arrhythmias, in terms of stability. So, then as the pregnancy went on, one other, having the ventricular arrhythmias, I have an ICD, which I've had for almost 20 years, to be honest now. And the battery was running low at my last trimester. So I did meet with an electrophysiologist just before just before delivering, to make sure that we had enough battery power, which is kind of a funny consideration, that if there was an event that happened, that it would cover me. And even though we were on the last little bit of juice that it was confirmed that I should have enough power. And boy, did I not think I would need that, but it turned out I did. So we went through it delivered a baby girl at 37 weeks. We were able to deliver her without a C-section. The hospital, I delivered her at the local hospital at UConn. Everything went actually very smoothly. The only trouble was that I had to spend that first evening up on the cardiac unit for monitoring. And unfortunately, babies aren't really allowed up there. So that was really tough. But it was reality, and I was safe, and that was what made a difference. And so I took our baby home, 3 days later, and all was going well. I was, again, we went through the medications that I was on, because something that I wanted to do was to nurse the baby. And so we were able to do that for the first bit of time. And then I will tell you, about a week and a half later, I was needing some air. So I took our dog out for a walk, and my husband, who's been incredibly supportive throughout this entire process from start to finish, of course, and of course, even more so now. So he took the baby, and I took our dog for a walk, and I was only, less than a quarter of a mile from the house, and I ended up having a bunch of ventricular arrhythmias. Again, this is about a little bit less than 2 weeks after delivering our baby, and had what was called an electrical storm. So I ended up on the ground and crawling over to a neighbor's house. And she knew that I had just had a baby. So she saw me and my face is all cut up, and she takes me in and she says, "Karen, how's the baby? How are you?" This is like 8 o'clock in the morning. And I told her what had happened. And thank goodness she was a nurse, and she helped call my husband. We helped call, got me in. And I actually had my husband, I was too concerned about my daughter to take an ambulance, which I should have done in hindsight. But long story short, husband and baby came to the hospital, and we figured out what I had. So I spent a week in the hospital, and then I was put on some more arrhythmia medication. So I was fortunately not able to continue nursing my daughter, but I turned out to be okay. And my daughter's just fine. She wasn't with me, and the dog was just fine too. And so following that, for the next few months to, I'd say, the next 3 years, things started to decline with my health, in terms of my activity levels, my fatigue, just in my ability to really need extra support. In terms, I got a lot of support from family. I got a lot of support from my husband with our baby, and that's what really made all this happen. But it was becoming very clear that things were changing with my heart. And at that point, I met again with Dr. Marin, and he had referred me to Dr. Vest and to the transplant team. And we did a workup, and I was listed. And I was listed for about a year. It's almost to the day that an incredible new heart arrived. And like Christian was saying, New Year's Eve, I got a call, and went in for a very successful heart transplant. So I was on the waiting list for about a year. And because I had the baby, which we think, I also had a high antibody level. So a match for me was a little bit more challenging to find. But Dr. Vest was incredibly on it, keeping me in the loop the entire time. And and so now we're about a year out, and we've got a 5-year-old. And there's definitely been some ups and downs over the last year, but so many ups to be able to do activities and play with our daughter, and my goodness, even read to our daughter like I was never able to do before. So it's been an incredible experience that I couldn't be more grateful for. Thanks for allowing me to share.
Yeah, thank you, Karen. That was extremely inspiring, just like the other two. I heard a lot of takeaways, everybody, for those out there, but I think some main themes that we definitely heard was how much and how important support is. So hopefully you all seek that out as you go through your own journey, and the ability to make sure there's high communication. Karen, it sounds like that was really critical as you went through everything, and appreciate you sharing all that. So I will now turn it over to Dr. Vest, which I believe has some comments and some facts and figures to share with us. So Dr. Vest, I'll turn it over to you.
Thank you so much. Thank you for the invitation to be here this evening. And thank you so much for all three of those stories, Shayla, Tiffany, and Karen. I've been privileged to be involved with things that have transpired for you over the years, but still, I learned extra facets of your stories from each of those lovely conversations. So thank you, really very meaningful. I think it's amazing that we've ended up putting together a panel here that actually spans the 3 areas where heart failure and transplantation and pregnancy intersect. And so, without going into specifics of any cases, I'd like to just talk through those 3, because that would be cardiomyopathy or heart failure that exists for a woman before pregnancy, and how one may jointly with the caregivers make a decision about going forward to pregnancy and manage that pregnancy. Secondly, the situation of peripartum cardiomyopathy, which, as we've heard, is a particular type of heart weakness that occurs in the later stages or shortly after a pregnancy. And then thirdly, the very complex topic of pregnancy, or how to become a parent after a heart transplantation, or indeed any solid organ transplantation. So starting with the first of those, just a few things from a clinician's point of view that I'd like to share. It's increasingly a situation that comes up that women who have a cardiomyopathy, maybe something like hypertrophic cardiomyopathy, or in many cases a dilated cardiomyopathy, meaning the heart that's enlarged and weak in its pumping function. And sometimes women who are actually having heart failure symptoms may come to us either wanting to talk about pregnancy or even in some situations already pregnant. And so that's always a very challenging scenario. And the way we approach it as heart specialists is to, really understand where the patient and their partner, if relevant, are coming from, what their thoughts are, what their feelings are, how we can educate and help them make a decision going forward. The particular scenario that we often are engaged in is talking to a woman about how might we make that decision whether it's safe to go forward and pursue a pregnancy. So we're looking at things like, what is the ejection fraction? Very low ejection fractions would be a very high risk situation to proceed to pregnancy, whereas if the ejection fraction is maybe in the high 40% or 50% at this time, then that's better. As we heard, a number of our really wonderful medications that we like for people with the weak heart pumps are not appropriate during pregnancy. And so often in this scenario, if I'm meeting a woman who has perhaps been on medications for a few years, whose heart failure syndrome, so the shortness of breath, the fluid retention, the fatigue is improved, we may actually jointly decide to go through a situation where we scale back on those medications that cannot be taken during pregnancy. We're talking about things like lisinopril, losartan. The medication was trade name Entresto. Also our newer medications like empagliflozin, dapagliflozin. Those meds would not be a good fit along with spironolactone or eplerenone during pregnancy because they can be toxic to the developing fetus. And so we may choose to jointly come off of those medications with close monitoring of the echo or MRI, blood tests, check-ins about symptoms and see how things go. If things are stable, it may be appropriate to then go on to a pregnancy. All of these things are, of course, very nuanced and individualized. The pregnancy is often a time for very close monitoring, not only with symptom check-ins, vital signs, echocardiograms, also the BNP blood test we use quite a bit for ongoing monitoring. And that's a very much a team approach with not only the patient and their supports, but also the cardiologist and the obstetrician and maternal fetal medicine. And so that's something, we've certainly done at this institution. At the time of birth, we like to approach this by having a team care plan. So working jointly with the obstetricians, maternal fetal medicine, as well as anesthesia and the ICU team to decide how that birth is going to proceed. And then after the birth, there are certainly some considerations around breastfeeding. We like to get the new mother onto some medications. There are some that are okay to use in that setting, but probably it won't be the full set of medicines if one is breastfeeding. So that's how we approach the woman with a cardiomyopathy or heart failure. And there are certainly some situations where either right up front, the ejection fraction is too low, there have been recent heart failure symptoms and other signs of instability, where we are very worried about the outcome for both mother and fetus, and where we may use some of the figures and facts that are out there in the literature and present them to the patient and say, we really do not recommend pregnancy in this situation. But of course, it's always coming to a point of the patient having to make that difficult decision with the information and support we provide. For peripartum cardiomyopathy, as you've heard, this is a specific type of heart muscle weakness that occurs typically in the last month or first few months after pregnancy. It's an area of some very interesting ongoing research, and there may be some understanding now of why it happens, but it's often a very challenging scenario to manage. There may be the syndrome of what's called pre-eclampsia, which is when a woman's blood pressure is also high, and there may be abnormalities at the level of the kidneys as well. That can coexist. Some women present fairly stably, and these things are dealt with as the pregnancy progresses and all goes well. Some women present in extremis, in cardiogenic shock in the intensive care unit. And again, that multidisciplinary team has to come together to figure out how the pregnancy goes next and what the birth plan will be. overall, peripartum cardiomyopathy is actually one of the most recoverable heart conditions. So in a recent series in the United States, 72% of women who had a peripartum cardiomyopathy diagnosis actually had recovery of their ejection fraction to over 50%, most of them on the types of medications that we've all heard and talked about that are good for the weak heart. And in that series, 87% of patients did very well without needing any VADs or transplants and without any major adverse events occurring. So for the majority of women, the course goes well. But as we've heard, that may not always be the case. And so certainly peripartum cardiomyopathy is a situation that can lead to sustained heart failure after the pregnancy is completed. The third scenario is one that remains very challenging. How do we counsel women on pregnancy after any solid organ transplantation, but particularly the heart, that is already an organ that goes through a lot during even a very normal pregnancy? And at this point, I would say, it's really an area of some differences in clinical practice amongst different transplant centers. So if this is something that pertains to your scenario, definitely important to bring up these questions to your heart transplant team at your center and start to talk about what is the recommendation of the team, and in your specific scenario, what direction are they thinking in. But in terms of talking about potentially proceeding with a natural pregnancy, there are recommendations from the American Society of Transplantation that although high risk, there are scenarios that are a little more acceptable for transplant recipients to go on for a pregnancy. So in particular, beyond the first year after transplant, no rejection in the past year, having stable graft function, which in the case of heart transplant means a stable echocardiogram, and no acute infections or recent changes in immunosuppression. So in that scenario, it may be a situation where the care team is able to talk a little bit more about the pros and cons of proceeding with a natural pregnancy. Unfortunately, we do know from the amounts of literature that are currently available, which are a number of case series, so putting together the experiences of women who have been through that situation, that there can be complications both for the mother and for the baby. So in one large series of 157 women in this situation, 157 pregnancies amongst 91 women, about 70% of those pregnancies resulted in a healthy baby. And so there were scenarios where there was pregnancy loss or where there were poor outcomes for the expectant mother. So it certainly is an area that a lot of conversation and sharing of goals and expectations is paramount to. As mentioned, some of our medications, notably mycophenolate, are toxic to a developing fetus. Alternates can be used. In some situations, azathioprine is used. That would probably require some biopsies to switch over to an alternate regimen. And again, in considering a pregnancy and in caring for a woman who is pregnant after a transplant, there would be a large multidisciplinary team involved, lots of frequent check-ins and monitoring, and readiness to respond to whatever complications and challenges came along the way. So those are really kind of the three overviews of the situations that we do encounter. Every scenario is different for individual patients, so please only take that as a general guide. And if the situation pertains to you, please do open up the conversation with your caregivers about your wishes, your hopes, and how they may support you through that.
Thank you, Dr. Vest. Very informative. I think that's really helpful. And just to reiterate what she said, folks, if you do have a scenario where that may be of interest to you, talk to your specific physician to talk through the specifics and what may or may not make sense. We have about 10 minutes left, so I thought it would be good to open it up for some questions. I think if we could perhaps start with the panelists, Shayla, Tiffany, and Karen. One of the questions that I think a lot of people would wonder is, what advice would you have for women that either have heart failure already, right, and want to become a mother, or are mothers and then develop heart failure? What advice might you give them? Shayla, you're off mute, so I'm gonna have you go first.
I think, most of us already said this, but just to reiterate, going actually back to a story, I asked my nurse practitioner when we were thinking about having children, and I was just really concerned about, at the time I couldn't handle my own health and taking care of myself. I couldn't fathom taking care of a child. So I asked what she thought, and she said, Shayla, it takes a village. And that still rings true, as I have, with four-year-old twins. So I think just, making sure you have that support system, and also, having that honest conversation with your partner and saying, here's, the situation that lies ahead. And there's going to be days where maybe I need to have a timeout and lay in bed and not feel sort of guilty that I need you to take full responsibility of, managing the kids until I can rest. And just having that strong partnership and understanding that, here is our parenting plan, and making that well understood, because I think with Christian and I, that's really helped us, day to day with our kids. So.
Karen, do you mind sharing?
Yeah. Oh, sure. Absolutely. That rings so true, Shayla. Like, really having that open communication with your partner and with your family or anyone that you think might be as part of your village. Because as Shayla is saying, there's going to be a lot of days where you just don't expect it, and you just can't do it. As much as I can really relate to Shayla when she mentioned, that she wasn't sure if she was able to. And I'm sure a lot of her support team was also, and support system was like, boy, is this something that you really think that you can handle? I certainly felt a lot of that. And in the beginning, I thought, I'm going to go full force. I'm all in. So I'm not going to really ask for that much help. But boy, is that a mistake, because you really, really need that support and that help. And just to be able to say, hey, I'm just not up for it. I need to be in bed, or I need to make these appointments, and I need to be able to, make my health a priority so that I could be there for my family, for my child or children. And also just to be able to take care of my own health, because I'm sure every mother or family member, father can relate. Sometimes, when, you're raising kids, it's easy to kind of look after their best interests. And we sometimes forget about how important our own needs can be. So I definitely think that gathering that village and staying on top of things is really the only way. So you definitely have to be all in and have those like the emergency plans, like, well, what if, this person can't help, or, gather that village and keep fostering it.
Yeah, thanks, Karen. Tiffany, anything you might add? Advice?
Yeah, I think for me, the main thing that's really helped is knowing my body and how I feel on kind of a normal basis. That's one of the things I found really difficult, is that you may experience a symptom and not know, is it a problem? Is it normal? So contacting the doctors, I think there's a tendency for people to think oh, I don't want to bother them. I don't want to bother my team with this small thing. I'm sure it's nothing, but it could actually be something important, so just kind of trying to be in tune with your body and what's going on with it. And, like they said, knowing when to ask for help. One of the questions that came through on the Q&A, they're asking, how is everyday life different? So I think one thing that I've done is I know kind of when my body is telling me I need to take a break, and I don't hesitate to sit down, because I've had experiences where I went shopping and just kept on shopping, and, started to feel lightheaded and things like that. So it's now I know, okay, I need to sit down, I need to take a break, I need to drink water, things like that. So I'd say everyday life is different in that I rely on my support system more, but also I know when to take breaks. I don't feel bad about resting or when I need to, for me.
Yeah. And Karen, Sheila, I think that same question I maybe would pose to you both as well. How is life different? And I know you both talked about the importance of help. So people just wonder, how can they help in any way, shape, or form?
Yeah, I mean, it's really different, of course. I think with me, it's a little harder to answer because I was post-transplant and then had the kid, so I was already in fairly good health when I was raising the twins. But that being said, I actually think that, to Tiffany's point, being in tune with your body, and I think I'm actually more aware and more responsible because I'm a mom, and I think if I don't take care of my body at the end of the day, my kids are going to pay for it. Like I'm going to be in the hospital. My husband's going to be stressed out trying to manage everything with a sick wife. And I want to make sure that I'm trying to take care of myself. So I think I'm almost more aware now of how I'm feeling because I'm not just doing it for me. And then the other kind of added piece there is that I'm in connection with my donor family, and also just knowing that my donor mother knows my twins now, and I think that she is always asking about them, and so she's obviously in the back of my mind too, and I'm trying to make sure that I'm healthy for her, and also, you know, managing the kids because they really inspire her as somebody who lost her daughter. So there's just like so many different layers there. And then in terms of asking family what they can do, just like really being open about saying what, about being available, right, at the drop of a dime, if possible, and being able to pick up that phone to say, I need help. Mostly with, you know, taking care of the kids and things like that, or just picking them up, just really anything, having that communication.
Thanks for sharing, Shayla. So we have a few minutes left. I actually might direct this to Karen and Tiffany. You know, I think everyone's seen the benefits of Heart Brothers in different ways, but you did, I was under the impression that you both stay at the Heart Brothers house. So I think given that's a, you know, important part of the organization now, just, I think the group would love to hear what that meant to you and how that experience was.
Yeah, if it's okay, I also wanted to mention, you know, my connection with Heart Brothers had started when, you know, at Tufts, I was given a pamphlet and told a little bit about the Heart Brothers, and what they connected me. Actually, I had mentioned, you know, my situation and where I was, and I was so fortunate that I got a chance to connect with Shayla, actually, and she spent a lot of time and a lot of just put a lot of herself out there for me to understand what it was like to go through transplant. And as somebody that was terrified of the word transplant, and having a very young daughter at that point, and just you know, trying to even come to grips with how I was feeling, because like like we were saying, you know, every day is so different. And so I didn't know if, for me, a lot of it, I had a hard time asking for help at first, and I didn't know if some of these symptoms, what they were. But regardless, connecting with Shayla on a personal basis, and going through the beginning part of my transplant journey really, really made a difference for me. So I cannot thank her enough for being so open and honest and making that transition so smooth. And then as part of that too, you know, in looking for, she asked, well, what other kind of resources can I support you in? And I said, you know, all I know is that we definitely have to have this transplant. We're listed at Tufts, and when it comes up, I don't know when that's going to happen, but I need to stay in the area, because part of my plan was that I wanted to stay in the area in case of anything that were to need to come up. I would be right there. So for my first bunch of biopsies, and just to not rush back to Connecticut, being 2.5 hours away, I wanted to stay close for at least the first month after transplant. And so she connected me again, you know, with Heart Brothers. And the day I got my call, I also had heard, well, when I woke up from the transplant, that we were all set up to stay at the Heart Brothers house, which was an absolute dream come true. So it really worked out, because I ended up having a high level of antibodies post-transplant and needed to be hospitalized for a few weeks for additional treatments, which worked out phenomenally. And for a little while, my mom was able to come up there, and eventually, you know, my husband and daughter were able to come and visit with me there. And I was able to stay there and recover close to the hospital. And that way, if I needed anything, I could go back and forth. And that was just really, really a blessing for me.
Great. That's great. Tiffany, how about you? How was your, how did you hear about Heart Brothers, and then how did they help with your journey?
Yeah, I'll just share real quick. So I was connected with Heart Brothers by the social worker at Tufts when I met with her. I live in Maine, so it's 2 hours away from Tufts. And so I knew that it would be a challenge trying to figure out, how family could come to the hospital and stay in the area of Boston and things like that. So we reached out to Heart Brothers, and they were awesome in getting us connected with staying at the Heart Brothers house. It was good because that was actually my transplant was during COVID. And so my husband actually wasn't able to visit, every day for hours on end, like in the past he might have been able to. So instead of him, only being able to visit for a couple hours every other day, drive all the way back to Maine, then drive all the way back to Boston, he was actually able to stay at the Heart Brothers house. So he was able to stay there for, let's say 3-day stint and come each day to the hospital and see me. So that really made a big difference for me because I was kind of worried going into the transplant, what would happen, during COVID if he couldn't come in. So it made a really big difference for me. Yeah.
That's great, Tiffany. That's great to hear. Well, I wanted to say thank you again to our panelists, Tiffany, Karen, Shayla, and Dr. Vest. I hope everyone out there is both informed, but also more importantly inspired by the stories that you heard today. And if there's ever any questions, you should know that this webinar is going to be recorded, so you can certainly share it with other people that may have this on their minds or be concerned about it, and we'll get that to you out after as well. But let me turn it over to Hamid to help close things out.
Well, I've known all these ladies for a number of years. I've heard their stories before. And every time I hear it, I learn something new, and it just awes me. It just awes me to know what they have gone through and what they've accomplished. It's beyond measure. But I wanted to thank you, Christian, the panelists, Dr. Vest. You guys just continue to amaze and impress. And thanks to all the guests and participants who joined us. I think this personally, at a personal level, was a great, phenomenal program. As Christian said, we'll have it available on video. If somebody wants to reach out to us, we'll send it to you. And just a reminder that we'll have a webinar in February, on February 17th at 6 p.m. It's about heart failure and heart transplantation in the minority communities. And mentioned earlier, on the 10th of February, we have a patient support group for anybody who is experiencing heart failure, LVAD, heart transplantation. Join us, love to have you. We're gonna have one of the doctors from MGH speak a little bit about where COVID is today, especially in the immunocompromised community, what the recommendations are. I know there's a lot of confusion going on, so hopefully that will be assistant to those of you who attend. And thank you again.